Step 7. Male health. Before you see your fertility specialist, and you should try and provide them sufficient information on your medical conditions, medical history, and all medications you are on, and your lifestyle factors. So you can do that by completing the questionnaire. Usually your clinic send before your consultation, or you can send short email to your fertility specialist outlining all your medical conditions and medications and important lifestyle factors. So the reason for that is your specialist really wants to know if you have any medical conditions, if you're on any medications, or if you have any significant lifestyle factors which may be impacting your general health and your fertility, so that they can modify negative impact of those factors to your health and fertility. Okay, first thing they pay attention to is your body mass index. You should really try and maintain your BMI between 18 to 30. So still you can have a fertility treatment if your BMI less than 35 generally, but you should try and stay as healthy, as fit as you can during fertility treatment. So IVF can be very stressful, and you need to have support system in place before you start fertility treatment. You should have some trusted member of your family or friends who you can talk to if you're going through the stress of fertility treatment. You need to speak to your GP regarding any medications if you're on for mental health, and you may need to modify those medications. So exercise is very important, because that sends all the right signals to your reproductive system, saying that you're ready to father a child. So I would recommend to do at least 2 to 3 hours of moderate or intense exercise per week. So, and the food and vitamins important. You should eat balanced food, and you can take men's multivitamins during fertility treatment. You should not smoke, because smoking can affect sperm production as well as the DNA of the sperm. So if you're smoking, you should certainly quit smoking, and you should stop drinking alcohol during fertility treatment, or minimize level of alcohol. So you can drink occasionally, still it should be less than 1 or 2 units a day. So you should ideally stop drinking during fertility treatment. Illicit drugs are detrimental to your fertility, so certainly you should seek help if you're on illicit drugs, and you should stop using drugs during fertility treatment. And anabolic steroids is one of the worst things you can do to your fertility, because when you take testosterone or any anabolics, then it sends signal to reproductive system suggesting there's plenty of testosterone. Then your pituitary gland doesn't need to work hard to produce testosterone and sperm. Then it can shut down your natural testosterone production and sperm production. So it can take a long time to bring sperm production back to normal. And so especially if you become azoospermic, if you stop producing sperm because of anabolics, then it can take 6 months to 18 months to bring back your sperm production. Usually it takes HCG injections, FSH injections, and the fertility specialist guidance. And this why it's very important to tell your fertility specialist if you have used testosterone or any anabolics in the past, or if you are on any anabolics at the moment. So industrial chemicals and radiation is very detrimental to sperm production. So if you are if you're using any chemicals because of your work, you need to minimize the exposure to the chemicals. And you should tell your fertility specialist so that they will factor this in when they're analyzing the outcome of your IVF cycle. So you should tell your fertility specialist all the medical conditions you have, all surgical history, and if you're on any medications, you should tell your fertility specialist, because some medications can impact sperm production, and also some medications can make it difficult to produce sperm on the day during IVF. So you should tell your fertility specialist all the medications you're taking. Yeah, so generally it's very important, even before your IVF treatment cycle, for your specialist to have a full understanding of your health and the lifestyle factors and all the medications you're on, so that they can factor this in, give appropriate advice, and take appropriate measures to minimize negative impact of your medical conditions to your IVF treatment.